Get your favorite health tips right here on U24. Maintain your kidney by drinking 8 to 10 glasses of water each day. This can be in form of soup, tea, water, cooked grains and boiled vegetables.
My name is Erica Murunchi and welcome to Be Inspired by Erica. So today I want to talk about personal hygiene. Personal hygiene is not just a habit, it is a way of life. By maintaining personal hygiene, you will reduce stress, improve on your focus, show respect for yourself and others around you, to the people around you. Take care of your space and your life. Keep your room tidy, wash your hands, cut your fingernails, comb your hair, brush your teeth, and many others. Take care of your space and your life. Brush your teeth, make your bed, bathe, cut your fingernails, comb your hair, and many others. Make cleanliness a habit. Personal hygiene should be a priority. Cleanliness is next to godliness. Stay blessed. Much love. Thanks for watching.
For those who are still traveling, we pray that you reach safely. Interestingly, I have powerful ladies that are going to be inspiring, educating, and powering us tonight on the very important topic that we're going to look into, financing opportunities and status of implementation. And these powerful ladies come from a very, very important ministry. One is coming from the Ministry of Gender, Ministry of Gender, Labor and Social Development, a ministry that I most times define and term as the ministry of the people, by the people, and for the people. If you're a child, you're into this ministry. You go into adulthood or you're a youth, this very ministry. You're a woman or man, you're into this ministry of gender. You're working or not working, you're still under this ministry of labor. And also you happen to be an adult or maybe an elder or older persons, you're still under this very ministry. You're serving this country in different capacities, and social development, you're still under this very ministry. That's why most times I call it a ministry of the people, by the people, and for the people. Represented tonight by Stella Kanyesije, who is the SAGE Operations Coordinator coming from Kampala Operations or Kampala Metropolitan. Welcome, Stella, on the show.
Thank you, Amon. Good evening, viewers.
Interesting, we also have a very powerful lady joining us tonight. Is Nakajubi Gloria, is the Communications and Advocacy Lead coming from Uganda Parliamentary Forum for Social
Protection.
Social Protection.
Yeah.
You're most welcome, Gloria.
Thank you very much, Amon, and good evening, dear viewers.
You have heard and seen the kind of powerful ladies that I have in our studios, and we're going to be learning a lot from them. No consultation fee, and we are going to be into this kind of talk for the next 1 hour with you, our dear viewer. We're always here because we know that you're always there. This is the state of affairs. And the state of affairs this time goes into our older persons. If you are 80 years and above, if you are 78, 79, I think it is very important that you come so close to your TV and be able to take notes, because what we're going to be talking about favors you and all those that may be related to you. You could be having your grandmother, grandfather, mother who is about to make that age. But also we're going to look into the financing opportunities and the status of implementation of this program, SAGE. To understand SAGE, and for you who are asking what SAGE is about, Stella is going to help us understand what it is about, and Gloria will lead us into what financing opportunities are available for this program. But before we go into SAGE, when I tend to introduce the Ministry of Gender, Labor and Social Development as a ministry of the people, by the people and for the people, people still don't understand me. What does the ministry do? What is it about? If we look into its mandate before we come into SAGE as a program. Stella.
Thank you, Amon. The Ministry of Gender is, as he has said, it's a ministry for the people. It supports a number of programs that support vulnerable people in our communities. It supports vulnerable children. It supports the youth. It supports the elderly. There are two programs that are currently running. That is the social enterprise grants, that is for those that are 60 to 79 of age, and then SAGE itself, that is for those that are 80 and above. So it supports all those that are vulnerable in our communities to enable them manage the life of this world that is challenging, because all of you know we are not the same. So this ministry is there to support all those that are vulnerable in our communities.
We come to SAGE now. What is SAGE? Why was it introduced? When was it introduced? Who are you targeting? If you can take us the scoop.
Okay, thank you.
Or the background of this program.
SAGE refers to Social Assistance Grant for Empowerment. It is a program that targets older persons. In our country, I think older persons, we are looking at people who are 60 and above. So SAGE program started in this country as a pilot in 2010. At that time, the funding was not a lot, but they piloted in around 15 districts that were considered very vulnerable. So after that, after realizing that it had impacted very, very positively on people's lives in those 15, in 2015, more districts were added to the SAGE program. That time, the people targeted were 60 in the more vulnerable places of, for example, Karamoja region, and then 65 in other places where they piloted the program. But later on, in 2019, 2020, there was public demand for the program, and a national rollout was planned for the whole country. And at that time, the target group now was increased to 80 because the number had increased, and the budget was also a bit tight, whereby the donors that used to fund it had pulled out, and the government of Uganda had taken it on. So when you are a Ugandan and you are 80, you are all targeted for SAGE program, anyone who is 80. The criteria of selection is NIRA. Every Ugandan is expected to be registered with NIRA. So NIRA shares data with the Ministry of Gender, and it is shared with public service. The reason for sharing with public service is to remove all those that are benefiting from the pension scheme. because once you are a pensioner, you are not expected to benefit from SAGE. So after removing the pensioners...
Even when you have turned 80 years?
Yes, because you are expected to be getting
some money.
Pension, the pension on the pension scheme.
Okay.
Yeah, so SAGE, it is those that are 80 and are not pensioners. Yes.
All right. Interesting. For those who are not working with the government, or you are not on pension, the government still thought about you and they introduced this very interesting program that you also have money in your pocket. Interesting. Let me bring you in, Gloria. How do you come in? As Uganda Parliamentary Forum for Social Protection, people look at that institution powerful and working with honorable members. How do you then come in to help our mothers, our fathers, grandmothers and grandfathers in the village or in this country?
Okay, thank you very much, Amon. Very interesting discussion, and my colleague Stella. The Uganda Parliamentary Forum on Social Protection really is, you could call it, I mean, it is a Commonwealth kind of practice. In different parliaments, there are always these, what you may call like pressure groups that push a particular agenda. So for us, in this particular case, social protection, what we do is look at what are the key roles of a member of parliament, yeah? And we all know some of the key roles of an MP is to do budgeting. The key roles of an MP is to legislate, that's why they're called legislators, and also to do oversight, make sure that government programs, all the, where they send this money, because they have appropriated money, it means it's going to certain programs, to get to see whether this money is actually being implemented as it should, used as it should, or the different programs are being implemented as they should. So what we've been doing over the years, because we were formed in 2013, so basically a few years after Senior Citizens Grant. And the Senior Citizens Grant has been one of our major advocacy areas. But also to clarify that social protection is beyond the Senior Citizens Grant. And when we're talking about social protection, we are looking at, it's supposed to be, of course, we have a policy in place, which is called the National Social Protection Policy, of course, by the Ministry of Gender, Labour and Social Development, drafted in 2015. That policy stipulates that social protection interventions are those programs, policies, systems that are put in place. They could be both government or private, that help to protect people from poverty and vulnerability. And we all know that poverty and vulnerability is not only for older persons. Yeah, so we're looking at, the idea is to have social protection programs that cover Ugandans from the time they are conceived to the time they die. Actually, the term is from womb to the tomb. Yeah.
Okay.
Yeah. So
that communicates a lot.
Yes. So across that's because we know that across that entire life cycle, people interface or face different risks, different challenges that could push them into poverty. So the idea of social protection is to ensure that at each stage you have programs that keep or protect people from falling into poverty. So that's really social protection. So right now we know as a country really of course, depending on the resource envelope, there are not yet so many interventions that are ongoing. And some of them that are there are really donor funded, they are really project-based. But we all know that the biggest or the flagship national social protection intervention or cash transfer program that we have in this country is the Senior Citizens Grant.
Okay.
So the work we've been doing really as the Parliamentary Forum on Social Protection is, first of all, there was a lot of advocacy that was done to ensure that, as she indicated, that the program moves from just being in pilot districts and now getting rolled out as a national program. And of course, it caused a lot of discomfort in Parliament, and I think that's why, and we also like to state that sometimes social protection interventions are also political in nature, yeah. And we also know that some of the things that we get to see, usually one of the things that influence things to happen is usually political interest. So we're happy that from Parliament, members realized that, but why would a program be in someone else's constituency and not in my constituency?
Because when you tell me a pilot study, what I'm thinking is that they picked a number of districts, maybe 3 or 4, and we say, let's first try this out. But remember, you're giving out money in
you're
this,
giving out
and
money
letting other people be without.
And you know, but also we can appreciate that at that time it was being donor funded. Yeah, so I mean, for donors, they can choose where to operate and where not to operate.
Understandable.
But so when government eventually took it up, I think that was 2018, when the donors pulled out, and then it became an entirely government of Uganda funded program, which we really want to appreciate government for, yeah, because if the donors had pulled out and government was like, you know what, that was a donor program, so we're not going to fund it, you can imagine what would have happened. Those who were on the program could have also been dropped off, or the new ones wouldn't have been enrolled. So so over time, we've seen the budget increasing from I think started about less than 9 billion. And now,
I was going to ask, from a parliamentary perspective, how adequate is Uganda's budget in allocating funds for such protection, social protection programs, not just SAGE?
Yeah.
From the time you came in 2013, have you in any way realized that?
So it has really been, like you say, advocacy work really can be, it's long-term work. And we're also talking about the fact that we are a resource-constrained country, that we appreciate. The need is there, but the question is usually, it's a balancing act. They will say, okay, we've given you the 9 billion, so we are going to give another intervention. But now imagine, from 9 billion back then, now to what we're talking about, 121 billion Uganda shillings. That's a lot of money, and I think we need to appreciate government for that. And the work of the MPs that they've done to make sure that actually money goes to that particular program. But of course, now we're talking at looking at, because the advocacy that has been happening is to make sure that we reduce that age of the people that are receiving this money, but also, I mean, 25,000 shillings from 2010 to now. Research has actually shown that that money, because of inflation, it has reduced in value.
Yeah, true.
The number of things you would go to the market to buy with your 25,000 shillings back in 2010, they're not the same, or they are less than what you can buy now.
We're talking about 15 years later.
Yes. So I think right now they told us from 25,000, it can now get you things, an equivalent of 15,000 shillings. So a whole 10,000 shillings has been eaten away by inflation. So that discussion has been, okay, how can we enhance, or how can we increase this amount? And last year, Cabinet made a pronouncement that we are going to increase the value of the grant, but also reduce the age. And of course, that comes with a budget implication. So we need an extra 251 billion shillings to be able to implement that pronouncement. The money that we are now still in the corridors of Parliament to make sure that as the discussions for the next financial year's budget, which is ongoing, because right now we know that they are at the stage of the ministerial policy statements. Those have been released, so ministries are going to go back and see how they can actually work around that, but then those are going to be presented to Parliament for review. So for us, usually what we do when those opportunities arise, so we go in. When the Committee of Gender is reviewing the ministerial policy statement, so we go in and we present our position. Like, okay, you know what, as you discuss the budget, please can you ensure that we now have the 251 billion provided for in the budget as per the pronouncement by Cabinet. Then after that, we will go to the Committee of Budget. Yeah, and also there present our issue like, okay, for us these are the social protection issues that we are highlighting. Actually, like you had indicated, beyond not just the senior citizens grant, we're also talking about the child disability benefit. The Ministry of Gender is also developing that, where we will see that children with disabilities are supported, and we're looking at an amount of shillings 100,000. And so
Per child?
Per child.
Okay.
Yeah. So the
annual, monthly?
Monthly.
Oh, okay.
Because studies have been conducted to see what is the cost of actually taking care of a child with a disability. That may not necessarily be how much you would require, but I think it is a good start. Yeah, it is a good start. I mean,
it can help them.
Yeah, it can support them. It can help the caregiver to be able to take this child to a health facility. I mean, it is more of facilitating. Yeah. So, and like we usually say, a lot of these social assistance, because maybe to also highlight that social protection has two components. So there is one, which is social assistance, where government just gives you without you giving in anything. So that's why you find things like SAGE. But then there's what we call the contributory schemes. So like NSSF. So that one targets people who are actually able and they can be able to contribute. Yeah. And I think the biggest conversation as we try to make sure that we make these social protection interventions sustainable is how do we take advantage of this, the working population now, to be able to contribute to their own social security. Because at the end of the day, if you leave the working population of today to not contribute to their social security, they are not employed by government. They don't have a pension. But also remember that the public service pension scheme has been revised, so that is also going to be contributory. So we want to make sure that this population, because we also know that our majority of our population is in the informal sector, and most of the informal sector workers have not been saving with NSSF, so they do not have money, they do not have any kind of social security coverage,
and some of them don't see any reason as why they should. Maybe they lack awareness.
Exactly, at the end of the day there is need for that awareness, because if you don't now, those are going to become your SAGE beneficiaries in this day. So you'll have more members falling down to SAGE. When they grow old, they all graduate to SAGE.
So we better secure the future by awareness.
Invest in these young people now. If you're giving young people PDM, can you empower them with information that, you know what, if you invest, if you get money, can you put aside some money into NSSF, for instance? NSSF has opened up what they call the NSSF Smart Life. You can start from 5,000 shillings. Yeah, but also, and it is very easy. You just there, I think, I'm forgetting the code. It's on your phone, and then you deposit. So they can't start saying that, you know, I can't go, there's no NSSF office in my area. No, it's on your phone. And for that one, the good thing with that one is after a year, you can withdraw your money. Yeah, you can get your money, so it is easily accessible. It is not locked in like the other mandatory scheme.
But if we encourage them to keep withdrawing every year, then we shall not get.
Yeah, I think it's a good. Yeah, you see, it's a good start.
Yeah, sure.
It's a good start, but also
the assurance that their money is there.
Their money is there.
You
can access it, and you know the thing about social security, the issue is it targets not just old age, even other risks. So it could be a medical emergency, it could be an education risk. So you see, you have some money that you've set aside that you can access to cater for that kind of emergency or risk.
Thank you, Gloria. Still, I come to you. You are a coordinator, you are a SAGE operations officer, you have worked with the ministry, you go to the field, you meet these people, you have seen SAGE from its time it was established, that she says 2018. What is the current status and how?
2010.
2018 was national takeover.
Okay. From the time we were depending on the donors, and now that it is government taking care of it? How do you see, how do you weigh in? Is our future secured, as the people say these days? Do we still need prayers to pray for you in that we can be rest assured that we have that money coming through even in 20 years or 10 years or 5 years from now? What is the current status before we go into the future?
When this program was being supported by donors, the beneficiaries were getting 25,000, which they are getting today. We appreciate the government of Uganda when it took over the program. It didn't reduce the amount of money. It is just the age that they increased to 80, but they didn't reduce the money. And currently we are proud that we are serving 300,000 and 12 beneficiaries in the country, which is quite a reasonable number. And every year, the program targets more beneficiaries that make 80. So as far as the future is concerned, I am not very sure, but currently we have what to pay them for this year. We are catered for.
Are there future plans to expand the domestic financing and also increase the revenue? That may be someone who is listening and watching you right now can be rest assured, but maybe in the future you're going to reduce this money from 25 maybe to 50 or 100. How do you look into this? Because people have been saying, like Gloria put it, that a figure that was put a long time ago, 2010, 15 years later, this money may not be enough for our jaja there in the village.
Of course, it has been mentioned that the age needs to be lowered. My colleague has just mentioned
but lowering it also comes with the cost implication. You're going
the cost, yes, the cost, there are plans of increasing it, but it is still under discussion. They had suggested 35,000. Yes, when cabinet approves it, I think that it may be funded. The government will fund it, and the beneficiaries will get it.
To someone who would love, who is 79 now, and is watching you, and maybe is targeting 2027, or even this year, maybe they're making 80 years in the next month, or even this month. Even someone could have made 80 tonight. How can be enrolled into the system and they start earning money?
Every year, NIRA, which is our data source, it shares with us all those in the country that make 80. So everyone who makes 80, irrespective of the month, they are shared with us and they are enrolled to benefit from the program. So I think it is a good targeting criteria, because if we are just to pick from villages, we may miss out some. But all Ugandans that are registered with NIRA, every year, they are targeted, they are enrolled on the program. We work with Centenary Bank. They open accounts for them, program accounts. We don't use their personal accounts. Some people have personal accounts, but we open program accounts where this money is deposited and there is no interest paid. It is all given to the beneficiary the way it is deposited on their accounts.
Long time ago, used to do 3 months quarterly, and you do 3 months, that is 75. And by the time my mzee comes from the village to access any Centenary Bank branch, maybe at the district or wherever it is established, they will get their 70% because of 3 months payment or installment.
Yes.
Is it still the same, or you have changed it?
Yes, it is still the same. 25 is little, and if we are to pay monthly, we shall also incur, of course, the costs of paying it, and it may not have any value. So we give 75, which is 3 months. So it's a quarterly payment that is given to beneficiaries through Centenary Bank. These payments are made in communities. We don't want people to incur transport to get this money that is not a lot. So in communities, there are places which are identified for payment. It can be a primary school, some county headquarters, where these people are mobilized and they are paid from there. We work through government structures. These are, we have focal persons per district. These focal persons coordinate with sub-county community development officers, who also coordinate with the parish chiefs, and they mobilize at village level, and this grant is delivered to them in their localities so that they don't incur costs. Maybe another issue, those that are very, very vulnerable, because ATA is not easy. There are those that are very frail, those that are very sick. We enroll them from their homes and they are asked to give us, we call them alternative recipients. If you have a child, a neighbor, or any supportive person, trustworthy, they give them to us and we enroll them as alternative recipients. These
that
people,
would be the next of kin, as many call it in banking?
No. This is alternative recipient for a beneficiary who is alive. You are alive, but you are very weak. You give us
someone
an
who can
alternate
receive this money
who
for
will
you.
receive this money on your behalf.
I thought you are giving
The
an
next
alternative
of
that
kin,
someone to benefit on your behalf.
No. This is not their money. They
Okay.
speak on behalf of the beneficiary.
Okay.
They are expected to deliver the grant the way it is, the whole of it. You've talked about next of kin. This comes about when a beneficiary dies. Sometimes they die and their accounts have already been credited. When they die, we expect the community to inform the program. During payments, we roll call. When we roll call, they inform us that some have passed on. Or the parish chiefs also, it's their duty to find out those that have died and report, or even the families of these people. After reporting, when an account has some balance, the family will hold a meeting and identify a next of kin. This is the person who will be authorized by the family to receive the balance on the beneficiary account. It's not, some identify their alternative recipients as next of kin, but it's not a must. When a beneficiary is alive, anyone they trust can be their alternative recipient. It can be a reverend at church, a community member who is trustworthy. But after the beneficiary has died, it's now the family to hold a meeting and identify a next of kin.
Okay.
Yeah.
All right. That is very understandable. I was looking at this 80-year-old man or woman to walk to where they pick this money from. It can be challenging. It can be challenging. Interesting.
Yeah, but we try to identify centers in
that
their communities that are near their homes, where there is shelter, where there is furniture where they can sit, for example, primary schools, churches, sub-county headquarters, so that they don't incur costs or walk very long distances to collect their grant.
15 years is not just a short time. Looking at the time this was established to this time, apart from enrolling it throughout the country, which other milestones do we celebrate now and the 15 years that it has, or you have marked?
Yeah, over time, I think our beneficiaries have changed lifestyle. They have their basic needs. These are people who don't work. Some don't have supportive children, yet they need food. They need warm clothes. They need the basic needs everyone is supposed to have. This money has enabled them to buy these basic needs. it has also helped them to improve their health. They need medicine because some of them have many ailments that are related to old age. It's not enough, but it supports whatever income that they have. They have also been able, some are also burdened with grandchildren who they have to feed, who they have to pay school fees for. And this little money has enabled them to do such, to buy them books, to buy them clothes. Then at the same time, it has also empowered them in a way, the self-esteem in the community. It comes to a Sunday, they have something to offer in the church, so they feel more comfortable now compared to before. They used to.
They no longer beg.
Socially now, they have this self-esteem in their communities. They no longer beg.
Interesting. Gloria, how can Parliament influence prioritization of social protection in national budgeting? Because when it comes to social protection budgeting and allocation of funds, they may say, no, we have other priorities. We have roads, infrastructure, we have hospitals, we have security, and you find that social protection is considered not a priority. And I want to learn from you how you are advocating, because at least you have gone through communities, you have interacted with people. You can see from Stella's submission, you can see how SAGE is transforming lives and helping the old persons.
Yeah.
How are you advocating that maybe parliamentarians tend to see this in a different lens?
Yeah, you know, the discussion on social protection has also grown over time. Yeah. Before, people would look at social protection as handouts. Yeah, you know, they just. But also, we also do have to appreciate that social protection is a right, which is enshrined.
And many will view that as a political.
Yeah, it's a political tool that government is using to influence. You know, maybe they will say it is an NRM program. You know, those kinds of things. But like she can rightly state, regardless of your political party, you are able to receive, you're a beneficiary of the senior citizens grant, because party is not a qualification. Yeah, so I think what we've been doing really, and we can definitely understand why a lot of times it has failed to get the interest or the response that you would require, and maybe getting to miss in budgets. But I think what we're trying to do is to consistently communicate the returns on investing in social protection. Yeah, and she has also stated it that when you look into the community, these older persons are now they're able to facilitate grandchildren to go to school, and in a way, government has put in place schools. But if the children are not facilitated to go to these schools, then that investment is underutilized. Yeah. So you see there, it is facilitating that particular service. But also, when these older persons receive money, they do not hoard it or keep it in under their blanket or something. They are going to buy from the next shop, they're going to buy from the market. Do you know what it means to put 121 billion shillings in the economy in a given financial year? So you're hitting two birds with one stone. First of all, you're improving the livelihoods of your older persons, but also you're boosting the economy. Yeah, so that shop that would have ideally not had clients this particular quarter, there is this older person with 75,000 shillings they're actually going to spend.
Maybe 10 in the various community.
Yeah, so that kind of ripple effect that it actually has. Yeah, so those are the kinds of discussions that we want to have, that we don't want government to look at it as we're just throwing money. No, but we're also saying that you are investing in your population. Older persons are a responsibility of the state, and actually the Constitution states it quite clearly that the state will come up with those interventions to protect older persons. So it's not an issue of discussion, but like you said, there are rights, but I mean, they are usually ignored. So that's why advocacy becomes very, very important, to actually direct people's thoughts, direct people's interests to a particular issue. And but also again, we're trying to say that when you invest in social protection, yeah, you are, like I said, you're investing in your human capital. Yeah. So the quality of the people that will eventually use your roads, that you're saying your priority is the roads. If you don't invest in these people, then also your roads are going to they're going to be using them to do what? To dry cassava. What is the return? Yeah, but the more you invest in your people, you're empowering them to be able now to productively use the other services in the economy. So that is really the facilitation role that social protection plays beyond the senior citizens grant. And again, we've said, yes, government did appreciate that, the older persons are really in their how do they call it? The last stage of life.
In the evening?
They're in the evening of life, yeah. So should we just watch them and let them die? But also looking at statistics, we see that the levels of vulnerability of poverty, you tend to be higher with the advancement of age. So yes, government did see it fit to invest in those ones for now. But now we are saying, okay, yes, older person, we've invested there, so now can we see a more comprehensive approach to social protection? So that these things start kind of facilitating each other. So you invest here in children get good jobs, children start investing in NSSF, you reduce the money you're sending to SAGE. You see how that actually, at the end of the day, it is more of, it balances itself out. But those have to be very deliberate decisions that are taken, and not just decisions, but also decisions that are followed with money.
Okay. Yeah. You're into advocacy, but also that August House is into the oversight. I am wondering how effective is the parliamentary role in ensuring that these social protection funds are fully and properly utilized. It is one thing to inject this money into the community, but it is also one thing for this money or these funds to reach out to the intended persons.
Yeah. Yeah, but also to highlight, and she can really bear witness, I think the Senior Citizens Grant has been one of the most effective interventions we've had. Why? Because this money goes directly to the recipient. There's no one in the middle that I'm going to send this money to the DCDO or to the parish chief. No. Direct to the beneficiary. Yeah, I think that has been a very good mechanism to make sure that this money, but also what we do as the Parliamentary Forum on Social Protection, more regularly we do what we call monitoring visits. So we get our members of parliament at this point, this parliament that is concluding its term. We've had over 250 members who subscribe to our forum. Yeah, and so regularly we organize what we call monitoring visits. We pick a district or 2 or 3 and then go. And then we actually target our program around the time the payments are being made. So you go to the pay point or the place where they're actually paying older persons and have MPs interact with these older persons. Get to hear their views. What do they think about the program? How can it be improved, especially in terms of how it is delivered? Back then we used to have issues around waiting time. Yeah, they would say, we come here, we sit from morning, the bag comes at 1. We have not eaten.
Or perhaps they tell us to come next day.
Yeah, so you come and then they will not show up. And sometimes I think they would miss the messages you send out. So someone, maybe someone else tells them, these people are coming to pay. Maybe that person receives from another point, so this one also thinks even at my point they are going to come. So the person reports. Yeah, so there used to be those kinds of miscommunications. So they get to share all those with the members of parliament. They used to share about the issues around the dates for the national IDs, the errors on their national IDs where I am 80 or over 80 years, but my ID is reading 65. Yeah, so all those issues,
or even particulars, the names.
Yeah, even the particulars.
I've heard that some names, even when you miss one letter on your name, you are not that person.
Exactly, you're not that person. Yeah, so there has been all those. So what we usually do is we pick those issues. So when when we go to the monitoring visits, from there then we come back and have these discussions with the MDAs or the ministries, departments, and agencies that are charged with those
the stellars. In this case.
Stellars. That would be more for the operational. But then when it comes to national IDs, we've had engagements with NIRA. But and maybe to try and make recommendations.
Do they listen to your recommendations and sometimes go ahead and implement them?
Yeah, we've had the residual registrations and the corrections for errors. I think the ministry has been doing that, where they've actually been going to make sure that they support these older persons to be able to correct their errors on their national IDs. You know, it is a very tasking process, but also costly. Yeah, you have to swear an affidavit. You're talking about an 80-year-old. I tell, look for a lawyer. You know, so an older person, that becomes a bit challenging. And for social protection, we try to ensure that, because you're looking at people that are already vulnerable, you don't want to make them more vulnerable again or exclude them from interventions they should be getting. So I think ministry has been doing that to make sure that they support these older persons to correct their errors, to correct age. And those have really been from conversations that we've been having. You go to the field, pick an issue, then map out which ministry, which MDA, or who can handle this, and then communicate these issues. And yes, we've seen improvements. We can't say it is perfect. Yeah, I mean, we know works are ongoing, but also, and there's room for improvement, really.
Okay. Yeah. Interesting. Stella,
to add my voice maybe to that issue. The program has a monitoring and evaluation department. This department, which checks us and checks the beneficiaries.
Okay, what do they check on the
basically the beneficiaries.
What do they check?
I talked about alternative recipients that pick their money. We've got cases where some of these people don't deliver this money. So this monitoring and evaluation department conducts alternative recipient verification exercises. We identify some benefit, we sample, then go to their homes and ask these vulnerable beneficiaries who are frail and have alternative recipients to confirm whether these alternates actually deliver this grant. And the beneficiaries are at liberty. If they are not receiving their money, these alternates can be changed. If this child has become unfaithful and has not delivered your grant, you are free to choose any other person who can deliver this grant.
That's a good one.
Yeah.
Interesting. You're into operations, and I'm wondering, from the time you go into the communities, you have gone to the beneficiaries and those who receive the monies. I am looking at the operation bottlenecks that you have encountered. You say, from the time we have enrolled this system, A, B, C, D needs to be improved. What are the challenges? What are the bottlenecks that we need to give attention and address?
One of the biggest challenges we encounter are beneficiaries. They are supposed to be beneficiaries who didn't register with NIRA. They are older persons who have no identity cards. It becomes, so they are excluded in the program, yet they are 80. It is very challenging in that there is no way you can consider them until they register with NIRA. So what we do is to coordinate with the NIRA officers in those districts to help those people register and get identity cards. That is one. Then those others, she talked about it. I don't want to talk a lot about it. Those that have IDs that have errors. Someone comes, you really see her or him so frail, but the ID is reading 60. There is no way you can consider this person. They have to go through the procedure she has talked about, swearing affidavit, and many other things they have to do so that
have you not encountered the same
corrected.
The same problem, but in a reverse way, where people are still young, but their IDs are reading 80?
The suspected underage. Yeah, we also, of course, cannot serve them.
What do you give out?
When we serve them,
because
that
that's what
means
is.
The older persons, some older person will miss out.
But the ID is showing.
The ID is showing, but you are not. You are not. Some we tell them and they admit.
There are people who grow when.
So we have a suspected underage case, which is usually not considered. Then the other issue is, of course, the little money. They tell us the 25 is not enough. We've been talking about it over and over, but the government is promising. Yeah. Then, of course, the age is also a challenge. They say 80 is too old to enjoy the money.
When I posted our poster for this program, someone said that in Uganda things are different. You tell us to retire at 65, but you benefit at 80.
But now,
should retirement age be extended to 80?
We are looking at people who have worked for government and they are catered for by the pension scheme. And SAGE doesn't target pensioners. So the other challenge we experience is death reporting. Some people hide death, especially these alternates, because once they don't report, then they continue benefiting. But we have planned, in fact, we have started to conduct a proof of life exercise, which is going to help us a lot to clean the payroll.
Nationwide.
When
is it starting?
It has already started. It started on the 16th March in a number of districts, like 30 in the country. In the country, we have 10 regional offices to make sure that service delivery is easy at district level. So each region is implementing in a number of districts. So these districts have started, each region has started in either 2 or 3 or 4 districts. So a total of about 30 are all doing the proof of life exercise. And every beneficiary is expected to be validated when doing this exercise. We have some that can go to the bank. Those that are able to go to the bank, they go to the bank and get their money. But we encourage all of them to go to the centers. We call them pay points for this validation, because it is going to end around June. And those that will not be validated, they will be suspended. We suspend the account. When we later on find out that these people are alive, then we reinstate them. But every older person or the alternative recipients that take care of them, or any other person that stays with or is a neighbor to an older person that is 80, encourage them to go for this proof of life so that you are not suspended from the program. Yes.
Interesting. Time is fast spent, but we still have a lot to talk about. But Gloria, what reforms do we need in this country to make sure that financing opportunities are sustained, and also we look at the implementation that is effective? Do you see that there are gaps from the gaps that we have all discussed? What reforms do you recommend for all the partners and stakeholders in this?
One of the key policy recommendation that we've been talking about is really to have a law, like a Social Protection Act, so that we have, when something is expressly provided for in the law, it is easy to enforce. In that if government or Stella does not deliver a senior citizens grant, these older persons can take you to court, can take government to court. They're like, you know what, by law you're required to provide this, so I'm taking you to court because it is provided for.
So for now, it is still a
becomes mandatory. It is a right, but when rights are not backed by legislation, a lot of times we find ways to wiggle ourselves around them, and you can give, you cannot give. Yes, you are required to do, but so a social protection,
and that as well can be a reason as why we don't even prioritize them when it comes to budgeting.
Exactly. And then also, of course, the other thing is we're trying to see that can we have each program that is being implemented in this country, especially these livelihood programs, like I was saying, PDM, can we have a deliberate move to ensure that there is a social protection component attached to it? So if you're giving young people money, can you empower them with the skills to be able to participate or to contribute to social protection? If we have programs like UWEP, can you empower those women that are receiving this money to be able to contribute to the different voluntary schemes? Because we know there is a voluntary scheme at NSSF for those who are in the informal sector. But also, and now we know the law right now, so there is also an enforcement issue. So for those who are not receiving the social assistance, now for those that are contributing, we have a law that requires, before, private sector, if you had, it was about 5 members and above. But now, as long as you are employing someone, you're supposed to contribute to NSSF. So it was opened. Can we have that enforcement so that we have everyone protected? And again, of course, I think for me to appreciate government for for transforming the public service pension scheme into a contributory scheme, because the public servants are already earning. They have the capacity to pay for their own social security. I think why it had been that the taxpayer, over and above paying these people's salaries, you also had to pay for their social security or their pension. And yet for someone who is in the private sector, they take care of their salary, but also they take care of their own social security. Now it is a good thing that we are seeing that now they're going to start contributing. And so the question was, okay, can we now have that money that was going to the public servants, can we now push it to the vulnerable people, now like older persons? If we're talking about increasing the grant value, can we now have that money going this side? Okay. We can look at it as it's more cross-subsidization. But also, can we have government pass what we call the National Health Insurance Scheme? Because we know that the biggest proportion of people's money goes into health expenditures. They talk about out-of-pocket expenditure at about 40%. It's very high. So the National Health Insurance Scheme needs to be passed so that we can actually have people accessing quality health services. So I think for me, those would be really some of the key recommendations or key things that government needs to do to be able to improve the state of social protection in the country. But again, we've said that social protection is not only government. So what are these private sector? What is the private sector doing?
I was also going to ask, you're into advocacy. Is it possible that you also advocate for us, maybe attract other partners to come and even give a hand? Because we see government may not be able, maybe you or even other partners or even government institutions that can help. Do you see having more partners that can help and give a hand? Because this is a very good project that we should take on.
What we know is there's a lot of interventions that are ongoing. doing. And I think one of the things that we've also been talking about is the issue of coordination for the different players that are actually doing social protection work. So you'll find NGOs, you'll find development partners, those are international embassies, you'll find other international agencies doing social protection interventions, but those interventions are not really properly coordinated. Even the ministry sometimes doesn't know.
Okay.
Yeah. So can we have some kind of proper coordination so that we have like a system where all these interventions are actually being implemented, and then we can have proper targeting so that we don't have people benefiting here and then benefiting from the other one, and yet there are others that are actually not benefiting.
I wish I had more time to take on this discussion, but time is not on my side. I'd request to get your parting shots, Gloria, and then I will come to Stella.
My parting shot definitely would be to ask government to be able to allocate the 251 billion shillings that we need to reduce the age for older persons, but also the 15 billion shillings to kickstart the child disability benefit. As the budget process goes on, please, can we have that money so that our vulnerable populations can actually be protected, but also can be able to participate fully in the economy.
Interesting. Stella, what are your prayers to make sure that the older persons in this country still benefit from this 20,000 for the next 30 years to come?
I call upon all those older persons who have errors on their identity cards, who don't have identity cards, to register or have them corrected with NIRA so that all of them can benefit from this grant, because it is meant for them. Then this proof of life exercise that we are doing, I call upon all our focal persons, all our parish chiefs, so the community development officers, to mobilize them to come for this proof of life so that they are not suspended from getting this grant. We also have people who were targeted, but we have never seen them. These lists have been shared with communities, and we expect, if they are still alive, all those on that list should come and be enrolled to benefit from this grant that is meant for them. That's it.
All right, and that brings us to the end of our discussion here on the state of affairs. We are looking into SAGE program, financing opportunities and status of implementation. I want to believe that we picked a leaf from our conversation. There is an exercise that is going on, the proof of life. If you have someone that died and you have been receiving their funds, it is the right time now you come clean and say so and so died, but have been receiving money. I think they will part of that money that you have been receiving, but you will not be receiving, and that is very good. And for those who may not come, you may be mistaken to have not been living, so it is better come and make sure that you prove that you are living and that you continue benefiting. It was a privilege having you, Gloria Nakajui, Communications and Advocacy Lead from Uganda Parliamentary Forum, Special Social Protection. Interesting. Yes. And also we had a privilege to have Stella Kanyesije, is the SAGE Operations Coordinator, Kampala Metropolitan or Kampala Region, coming from the Ministry of Gender, Labour and Social Development. And that brings us to the end of our conversation. From me and the team, it's a good night. The repeat of this program is always on Friday from 10 to 11 a.m. You can create time and be able to follow this conversation also on our social platforms, that is X on the U24 television and YouTube, and as well Facebook. For God and my country, I'm Paida Amon Otega, and I'm sign out.